Hello everyone. Good afternoon. I'm Shreya from Bladder Wellness team. I'm sure you all must be in good health. Today we have with us a very renowned Dr. Dhaval Gosalia from Mumbai who will be educating us on a very important topic, stone management. Welcome, sir.
Thank you
Dr.
very much.
Dhaval MS MCH Urology is a urologist, andrologist, and a kidney transplant surgeon at Bombay Hospital. Dr. Dawal has rich experience in this field and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that the patient's health is in safe hands. Let us hear more on stone management from Dr. Dhaval Gosalia himself. Over to you, sir. Doctor, I'm not able to hear you.
Now?
Yes, you're audible.
Yes.
Please go ahead.
Yes. So good afternoon, everyone. Am I audible?
Yes, doctor.
Yeah. So kidney, ureter, and bladder stones are a quite common presentation in urology OPD. So we see a lot of patients in the OPD as well as in the operative theater, the operation theater for the stone management. So you can go ahead with the questions and then we'll discuss it out in detail.
Definitely, doctor. The first question would be, what are the symptoms of kidney and uteric stones?
Fine. So we would divide this topic into two parts.
Yes.
One is kidney stone and one is the ureteric stone.
Yes.
So when we see the kidney stone patients, when the patient comes to the outpatient department, the most common symptom of both of them is usually the pain. Now, first of all, for the awareness of the patient has to know whether this pain is because of the kidney stone or because of something else. Now, we just to brief with the anatomy of the kidney. The kidneys are basically two organs which are situated right in the back. They are the retroperitoneal organs. So the pain of a kidney stone usually starts in the flank area. This region we call as a flank, or in Hindi we call it kamar ka bhag. So the patient usually reports a pain right in this flank region or a lumbar region pain. Now, of kidney stone patient, the most common presentation is usually this pain, which is typically the flank pain. And because of this pain, sometimes because of the severity of the pain, they can present with bouts of vomiting or then can be associated low or high grade fever. So this is usually the typical presenting symptom of kidney stone.
Okay.
Now, both the kidneys are joined together by a tube called as ureter. Now, this is a 24 to 26 centimeter tube which carries the urine from the kidney to the bladder. So, ureteric stone, whenever the patient has a ureteric stone, when the stone slips from the kidney into the ureter, the pain is usually a colicky pain. Now, this colicky pain, the word colicky means ureter has specialized muscles. So, whenever the stone passes down the ureter has a own peristalsis, and because of this peristalsis, the pain usually starts from the back and it radiates down right up to the groin area. So it is typically a severe pain which is colicky, starting from the back coming down to the groin. So it is a radiating colicky pain. So patient you will either with the ureteric stone or kidney stone has to first identify that this pain is because of the stone. Another symptoms of ureteric stone, if the ureteric stone comes right down into the ureter where it joins the bladder, the patient can report difficulty in passing urine or going to the washroom very frequently or passing very small amounts of urine. They may also have little blood in the urine. So these are the typical symptoms of kidney and ureteric stone. The most common symptom being pain. Kidney stone pain is usually dull aching in the flank region. Ureteric stone is a more severe pain, which is colicky and radiating towards the groin. Associated fever, vomiting, little blood in the urine, which is called as hematuria, or difficulty in passing urine, depending upon the location of the stone. So these are the typical symptoms when we see a patient in the OPD. Or when the patient comes to the emergency room, he has severe pain and we have to start him on painkiller and then investigate accordingly.
Okay. So how are the investigations to be done, doctor? On the investigations on the kidney and ureteric stones as well?
Correct. So when the patient comes to either the outpatient department or the emergency department, first of all, the most important thing in management is pain management. because patient comes with severe pain and vomiting. So for first we start with the painkillers, we give antiemetics for management of the vomiting, and then we start the investigation.
Okay.
Now, this investigation we would divide into three parts. One is the blood investigation, another is a urine investigation, and
Okay.
the third part is a radiological investigation, that is some kind of imaging.
Okay.
Now, blood investigation, we usually start with complete blood count, that is a CBC, which is very commonly done. So in CBC, we look for the WBC count, whether there is any infection or inflammation because of this stone. Then we see the creatinine level, that is a kidney function test.
Okay.
Then, in those stone patients, we usually ask the history of any diabetes, blood pressure, or any associated problems in them, and we investigate according to that lines in the form of uric acid levels, calcium levels, or blood sugar levels, depending upon the. It varies from patient to patient. Whether the patient has come for the first time with this stone, or patient already has some history of stone disease and he has come for the second or the third time. Another investigation we usually do is a urine routine microscopy, in which we see whether there is any infection, whether there are any pus cells in the urine, what is the whether there are any crystals in the urine routine report. And if the patient has presented with an episode of fever, we tend to do a urine culture report and treat them accordingly with the antibiotics. The
Okay.
other investigation is the radiological investigation to confirm our diagnosis. Now, this investigation would be either a sonography or a CT scan.
Okay.
So usually, by and large, we start with a sonography, and in sonography, we see what is the size of the stone, where is the stone situated, is what is the amount of swelling in the kidney, which is medically called as hydronephrosis, whether there is any hydroureter. Ideally, the investigation of choice should be a CT scan. Sonography is usually observer dependent. So
Mhm.
when patient does a sonography from a different center, the size of the stone may vary. It is an observer dependent investigation. And the treatment or the management of a stone depends on the size of the stone. It is very important to have an exact size of the stone. So then
Okay.
the next investigation we do usually is a CT scan. And if the creatinine is normal, we usually go ahead with a contrast CT scan. This is the contrast that the radiologist injects from the peripheral IV line. The contrast passes into the kidney, and we see characteristics of the stone. What is the size? Every stone has a specific Hounsfield unit that is called as HU value. If you see a CT scan report, the value of that stone would be written. That is the hardness of the stone. So we come to know whether the stone is hard or a soft stone. Then what is the location of the stone? Whether there is any infection in the kidney, and depending on those findings on the CT scan, we further manage these patients. So the first important part is pain management and investigation in the form of blood, urine, and radiological investigation, that is sonography or CT scan, and then according.
Okay, doctor. Do all types of stone, that is kidney and ureteric stones, do they actually require surgery only?
So to be very frank, all stones, all kidney and ureteric stones do not require surgical intervention.
Okay.
Now, we'll divide this category into two parts. One is kidney and one is ureter.
Okay.
Now, when you see a picture of a kidney, it is basically made up of calyx. There are a lot of calyces, that is upper, middle, and lower. They combine together to form a pelvis of the kidney, and that drains into the ureter. Now, if there is a stone in the calyx of the kidney and it is small in size on a CT scan, that is 3 mm, 4 mm, this do not require any specific surgical intervention. Now, a pelvis, the stone which is there in the pelvis, usually depends on the size and the symptoms of the patient. We treat it. A stone, by and large, now the cutoff criteria for any stone is usually 7 mm, by and large. So it depends on the size of the stone in the ureter.
Okay.
If the stone is less than 6 or 7 mm in the ureter on a CT scan, not on a sonography, on a CT scan, if it is less than 6 or 7 mm, the patient does not have any pain or the pain has been managed properly by the urologist. If there is no swelling, very bad swelling in the kidney, or there is no fever, his creatinine values are normal, we tend to manage this patient with medical expulsion therapy, which we would take it forward in this session. What is medical expulsion therapy?
Mm.
And if the stone is more than 7, 8 mm, it is causing pain to the patient. There is hydronephrosis, the creatinine is more, the counts are more. Then we tend to intervene as quickly as possible. So usually it depends not on the size, not only on the size, but also on the symptoms of the patient, what are the blood reports, and what is the size on the CT scan. All these three things have to be considered, and then we take it forward, whether the stone will be managed medically or it would require he or she or the patient requires any surgical intervention.
Okay. So how are these stones actually treated, doctor?
Yes. So first of all, whenever we see a stone patient, we first, as we discussed before, we do a CT scan, and then we see what is the size of the stone, what is the hardness of the stone on CT scan, and what is the location of the stone. So any stone which is there in the kidney, we see the size. So for example, if the size of the stone is less than 1.5 centimeters on a CT scan, we usually advise a procedure which is called as retrograde intrarenal surgery. That is called as RIRS. Now, what is retrograde intrarenal surgery? It is a advancement in endourology which has happened in the last 2 decades or last decade probably. What is basically it's a scarless surgery. We go through the urinary opening and fragment or powder the stone into small pieces and take it out from there.
Doctor, suddenly we are not able to hear you.
Now can you
Yes.
hear me?
Yes,
Yeah.
yes.
So what we do for a stone which is less than 1.5 centimeters, that is a stone which is between 1 and 1.5 centimeters, we do a procedure which is called as RIRS, that is retrograde intrarenal surgery. I mean, this surgery, we put a telescope through the urethra. It is a scarless surgery, and it has been recent advancement in urology in the last couple of decades. We go through the urethra, we powder the stone into small pieces with the help of a laser. The other type of surgery is called as PCNL, that is percutaneous nephrolithotomy. It is usually for a stone greater than 1.5 centimeter. It is called as a pinhole surgery. We put a telescope from the back, we go inside the kidney, we powder the stone into small pieces and take it out from there. If it is a ureteric stone and it is larger than 8 or 9 mm, it is causing pain to the patient or infection in the kidney, then the procedure what we do is ureterorhinoscopy. We put in a telescope from the urethra, from the urinary tube, we powder that stone into small pieces with the help of a telescope. So these are the stone surgeries that we usually perform in those indicated patients, that is URS, RIRS, or PCNA. Now, in the last question, we talk about what is medical expulsion therapy. Now, unfortunately or fortunately, we don't have special medications to dissolve the stone. There are no special medications to dissolve the stone. If the stone is less than 6 or 7 mm into the ureter, what we usually start is medical expulsion therapy. Now, what is medical expulsion therapy? These are specialized medications which open the last part of the ureter, the last part of the ureter which joins into the bladder, it gets opened up and it helps the stone to pass off. So usually we start this therapy when the patient comes to us for the first time, and we continue this for 2 to 3 weeks till the stone falls off. So the patient has to be advised that he has to come for a follow-up whether the stone has passed or not. So this is medical expulsion therapy. We don't have any special medications to dissolve the stone. It
Okay.
usually passes on its own, but with this, it usually helps to pass the stone.
Okay. What are the kinds of emergency that comes up with related to these stone diseases, doctor?
Correct. So, as we discussed before, pain is an emergency for the patient. It usually presents with very severe pain. So, this pain is an emergency. Now, there are few patients who present with stones on both the sides. So, this becomes an emergency. When the stone obstructs both the ureter, both the tubes of the kidney are blocked by the stone, it becomes an emergency because both the kidneys, usually when the stone is there only in one kidney, the other kidney compensates for the function and we can wait for some time till the stone passes off on its own, depending on the size. But if both the ureters are blocked by the stone or there is stones in both the kidneys, then it usually becomes an emergency where the creatinine of the patient can rise, the patient can have high grade fever or infection in the kidney. That becomes an emergency. Then we have to treat that emergency by doing operative intervention. So this is an emergency pertaining to stone disease, that is pain, high grade fever, or stones in both the tubes of the kidney.
Okay. What can be done to prevent the types of kidney stones, doctor?
Correct. So, whenever there is recurrent stone disease, Recurrent stone is a patient coming for the first time. There is a 40% chance that the patient might have stone disease in the next following year, in spite of complete clearance. So this is what we see in an Indian population where the climate is hot and humid most of the in Mumbai especially, where the climate is hot and humid in most part of the year, the
Yes.
patients usually come very frequently with this stone.
Okay.
And it is very difficult to undergo surgery every time, even if it is indicated. So then the next question comes, how do you prevent this stone from forming? So stone, if you see, there are usually most commonly there are of two types. One is calcium oxalate stones, and other is uric acid stones. So what is calcium oxalate stone? It is basically as simple. It is a mixture of calcium and oxalate in different composition. So anything which increases the oxalate level of blood will form stone. So what are the foodstuffs which have high oxalate content? We tell the patient to avoid those food. So what are those? For a vegetarian person, it would be spinach and nuts. All type of nuts and spinach have high oxalate content.
Okay.
For a non-vegetarian people, it would be all types of animal protein. That is chicken, mutton, poultry, everything has to be avoided.
Okay.
Other thing is, first and foremost is hydration. The patient has to take that much amount of water that he passes urine 8 to 10 times a day. So the patient usually asks, what amount of water should we take? So it depends on season to season. So
Hmm.
he or she has to take that much amount of water that he passes 8 times urine a day. So that can be
Yes.
between 3 or 4 liters, 2.5 to 3 liters a day. Other thing, oxalate is coffee and chocolates. These are the two things which have high oxalate content. So those patients who have recurrent stone disease should avoid coffee and chocolates.
Okay.
Vegetarian, as we already told, spinach and nuts. Non-vegetarian diet, especially all types of animal protein has
And
to be
meat.
avoided.
Yes.
Other thing is basically this sodium, what we have, the sodium chloride, the common salt what we have. Usually the salt binds with calcium in the urine and forms that stone. So these recurrent stone formers usually have to take a low sodium diet. They should avoid all preserved canned foodstuffs which have high sodium diet in that, high salt content basically. And the salt content should be less than 3 gram a day, ideally.
Okay.
And the last is all types of aerated beverages, thumbs up, Pepsi, Sprite, Coca-Cola, whatever, they have to avoid this because it is an artificial sweetener. So this is usually the dietary management for pertaining to stone disease patients.
Thank you, doctor. We
Uh,
have few more questions from our viewers and myself too.
Definitely.
My
Sure.
question for you would be normally, if users regularly start consuming coffee and any type of cold beverages too, would it lead to formation of kidney stones for normal patients also?
So usually it does not. Our body has a specialized mechanism which causes diuresis. If you see coffee is basically itself a diuretic. It
Okay.
causes increase in the urine production.
Okay.
But there is something which is called as Randall's plaque. Now, in those patients who have propensity to form stones, there are small plaques in the kidney.
Okay.
Now, this is a genetic disease. It is not inherited. It is a genetic disease. I mean, it is inherited.
Yeah.
So in those patients who have Randall's plaque, those stone particles get deposited. It is basically it is not going to form overnight. So it slowly and slowly those particles get deposited in there and it then becomes a big stone. So definitely a normal patient won't have stone disease with coffee,
Coffee
but
consumption.
anything in excess is not allowed
Yes. True.
even for normal patients. But definitely, if a patient already has a stone disease, he should avoid coffee and chocolates, especially dark chocolates. It
That.
has cocoa and oxalates in high amount.
True. And there's a common saying, doctor, that the banana stems juice should be taken when we have such kidney stones. Is it true? And how does it impact a patient's health?
So it's a very good question, but the literature has still not confirmed whether any fruit juice, even cranberry, people say
Okay.
cranberry juice avoids stone disease,
Yes.
but there is still a very difficult to confirm this. The literature has still not proven this. But yes, there is no harm in taking. But then again, cranberry is juice, what we get in the market is a preserved one.
Yes.
So
True.
preserved cranberry juice should not be taken. It should be avoided by stone patient. The best is water, our
Yes.
normal water, what we take.
Great. We have a few questions from our viewers, doctor.
Definitely, yes.
Raju has a question for you. How can kidney stone surgery affect urinary tract health?
No, sorry. How can kidney stone
How can kidney
surgery,
stone surgery affect urinary tract health?
urinary tract health?
Yes.
So by and large, after a kidney stone surgery, we what we put is a DJ stent that is called as a double J stent. So if the stone is causing any obstruction to the kidney and it is causing infection to the kidney, removal of the stone would be more beneficial rather than just keeping that stone into the system. So
Okay.
by and large, it does not affect or harm the kidney. It usually protects the kidney.
Okay. Arvind's question for you is, what is a kidney stone strainer used for?
Kidney stone
Strainer, doctor. Kidney stone
strainer.
strainer. Yes.
I am sorry, I did not get this question.
It's a
Strainer.
kidney stone strainer used for.
Can you
Spell it
tell
out.
the spelling?
S
Spell out.
T R A I N E R. Strainer.
Sorry, I'll have to read on this topic. I have no idea about this. Sorry. Strainer.
Sure. Sure, doctor. Not an issue. Palkesh
Hmm.
has a question for you, doctor. Can obesity increase the risk of kidney stones?
Yes, definitely. So this kidney stones patients usually have something which is called as metabolic syndrome.
Yeah.
That is a cluster of syndrome which is diabetes, blood pressure, obesity, sleep apnea. So any not obesity per se, but obesity with diabetes definitely increases the risk of stone formation. And
Okay.
it is basically uncontrolled diabetes which causes defective ammonia genesis in the urine and that causes stone to form, especially calcium oxalate stones.
Mhm. Okay, doctor. Abhishek has a question for you, doctor. Can kidney stones be passed without medical intervention?
Yes, definitely. So as we discussed in our prior talk, kidney stones less than 7 mm usually passes off in 50 to 60% of the patients in 4 to 6 weeks. It usually passes off in four to
Okay.
six weeks.
Okay.
So this does not require any specialized medication apart from medical expulsion therapy. These are
Okay.
medications which open up the ureter of the at the junction where it opens into the bladder and the body naturally expels that stone. But yes, patients can report pain during that passage of the stone. So only pain does not demand any surgical intervention. Pain
Mm.
with fever, vomiting,
Yes,
or swelling in the kidney demands surgical intervention.
definitely. Dr. Prashant has a question for you. What precautions are to be taken to maintain the bladder healthy?
Bladder healthy. Okay. So usually this does not come into the topic of stone disease. Now bladder is an organ. It is bladder, right?
Yes, yes, doctor.
Bladder.
Bladder
So
health.
basically bladder is an organ which collects the urine from the kidney and expels it out through the urethra.
Okay.
Now bladder has specialized muscle which is called as the detrusor muscle.
Okay.
Now, so two, three things we tell to the patient. One is do not tend to over distend the bladder for too long. So while traveling for a long distance, every 2.5 hours, the person should take a break and empty the bladder. The other thing is that before just going to sleep, do not take too much amounts of water. So that the usually the old age patients have a problem of getting up too frequently in the night.
True, true.
So just prior to sleeping, a couple of hours prior to sleeping, do not drink too much of water. The other thing is if the patient has any prostatic symptoms. Now this is little away from the topic. Bladder issue is related to urethra and prostate. Because of the prostatic enlargement, the bladder can have effect, and this is separately covered in the topic which is called as a bladder health. So the other thing is the patient has to drink around 2.5 to 3 liters of water and frequently empty the bladder. That is the basic idea of the bladder health, nothing else.
Okay. Emptying the bladder, it agrees with all the normal patients or else only for the elders specifically,
No,
doctor?
all the
All of us.
patients.
So it's
Yes,
prescribed that we shouldn't take so much water before we go to bed, is it?
yes, correct,
Okay.
correct.
Okay, doctor. Thank you. Aditi Srivatsava has a question for you. Are there any specific risk factors for kidney stones in females, especially?
Yes. So females usually have a higher risk of urinary tract infection. Now, the reason for females having high propensity of urinary tract infection is because the urethra, the urinary tube which brings the urine out, is shorter in length. And in females, the vagina and the rectum and the urethra are too close together. So the bacteria ascends up into the bladder and the same bacteria goes into the kidney. So recurrent urinary tract infection in females is itself a risk factor for stone disease.
Okay.
So the same thing, a bladder, to keep the bladder healthy, good hydration and emptying the bladder frequently is advised in females. And if there is an episode of urinary tract infection in females, it has to be treated with antibiotics correctly.
Okay. Deepak Saxena has a question, doctor. Can antibiotics be used to treat kidney stones?
No, antibiotics do not treat kidney stones. If the
Okay.
stone has caused infection in the kidney, then antibiotics should be prescribed or it should be taken for the treatment of the infection, not for the stone.
Okay. Okay, doctor. How long, Milan Shah has a question for you, doctor. How long DJ stent can be kept in the uterus?
So it depends on the procedure which is done. Usually, by and large, we keep the DJ stand for 2 to 3 weeks.
Okay. Okay, doctor. Ankan Basu has a question. I have been suffering from chronic prostatitis from around 10 months and taking antibiotics. My age is 24. Now, the current bacteria of my semen culture is Pseudomonas, but the pus cell is 2 to 3. Is there a solution for this?
So it is difficult to discuss on this platform. I would
Okay.
like the patient to consult me once, and then I'll have to examine and take it forward from there.
Yes, yes, definitely, doctor. So when it comes to the elder patients, mostly, are there any specific precautions that they should be taking regularly on an old age basis?
For kidney stone per se,
Kidney stones formation, yes.
so the same thing as we discussed previously, good
Yes.
hydration, the salt intake should be less, no aerated beverages, no canned and preserved foodstuffs, and
Okay.
avoiding non-vegetarian diet. These are the basic requirement or the basic this thing for the stone disease patient.
Okay. So on a regular basis, you have asked us to keep our bladders clean, maybe 2 to 3 hours once or something. So during longer hours of travel, say if you are traveling from morning to evening via car or any road transport, is very essential that we should keep a track of the water we are consuming, or is it okay if we could hold up normally during the days also?
So once in a while, it should not be a problem. But those who are frequent travelers should make sure that they hydrate themselves well,
Okay.
especially those patients who have kidney stone.
Okay.
So this usually picks up in the summer season, we see a lot of patient in the summer season with
True.
kidney stone. This is all because of dehydration.
Okay. Can you prescribe a few things that we should definitely be taking during the summer seasons, doctor, as you say?
Water is the only thing that is most important. Nothing to be taken preserved.
Yes, yes. Any other specific message that you'd have for the viewers who have kidney stones or the recurrence of the kidney stones, however that happens?
So those patients who already have been diagnosed with kidney stones, we have already discussed in detail which patients can wait and which patients require surgical intervention.
Yeah.
Pain is something which is difficult for the patient to manage. It depends on the severity of the pain. But
Yep.
I would like to say that pain is not an indication for surgery. It is
True.
usually the fever or vomiting or obstruction in the kidney, which is usually demands surgical intervention.
True.
Ureteric stone especially requires a lot of patience from the doctor, from the treating urologist, and the patient.
Oh,
It takes 3 weeks, 4 weeks, 6 weeks sometimes for the ureteric stone to pass off. So
okay.
if the patient has pain and the pain subsides with those medications, I would still wait for the stone to get naturally expelled rather than going ahead with surgery unless it is causing complications.
Okay. Do you have a specific message for the viewers, doctor, before we end the session? Just an
So stay
awareness message.
healthy, no, stay healthy, stay hydrated, and stay safe. It
Definitely,
stands too fast like a kidney stone. I mean,
yes, definitely, Doctor. Thank you, Dr. Dhaval Gosalia, for your valuable time. This was
thank you,
quite an
thank you.
informative session for our viewers, and we definitely look forward for many more sessions in the coming time. Thank you,
Thank you.
viewers, for an excellent participation. For more information and updates, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you, and good day to you all.
Thank you.
Thank you. Thank you.